Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is the basics of the kyphoplasty procedure for vertebral compression fractures. First, let's look at the extent of the problem. Over 700,000 vertebral compression fractures occur every year in the U.S., and most of these actually are due to osteoporosis and are unnoticed because a lot of them just don't have pain. Half of women and a fourth of men will have an osteoporotic fracture during the life. And once a vertebral compression fracture occurs, there's a 5-fold increased chance of having another one. Symptoms of vertebral compression fracture: there may be no symptoms. A person may have back pain that worsens while standing or walking, aching, cramping. There may be limited spinal mobility due to the pain. And there may be some height loss, literally, or disability because of what you see here. Is some loss of the normal height due to the fracture. This is what's called the downward spiral of vertebral compression fractures. You get some spinal fractures, leads to back pain and deformity, because if you have height loss at multiple levels, it can start to cause increasing deformity. It can start to pinch on the lungs, can impair a person's function. They can lose appetite because it can pinch on the stomach. Can cause problems with sleep, decreased activity, more bone loss, increased fracture risk, and so on and so forth. And what you end up with is a significantly increased mortality percentage. So what are the treatment options for vertebral compression fracture? Prior to interventional procedures, what you had was either benign neglect, which is where you just kind of watched it, and if the pain got worse, then you provided some treatment. Medication management could consist of just over-the-counter options like nonsteroidals and Tylenol. For more severe pain, a person can receive narcotics along with some muscle relaxers if there's aching and cramping. And then you also have spinal bracing, like you can see here. There's one called the Jewett brace, Jewett. There's also a TLSO. But these braces can be effective, but if you live in a hot climate, they may just be uncomfortable. It can be a problem. So back in the 1980s, the vertebroplasty procedure was invented to treat fractures due to cancer. And basically what you have is in a minimally interventional procedure, you put a catheter into the fracture area and then just inserts bone cement. Okay, and it was very successful. In the 1990s, it actually started to be used for regular osteoporotic fractures. It's an outpatient, low-risk procedure that provides instant pain relief. Well, the kyphoplasty became an evolution of the vertebroplasty procedure. It was FDA cleared back in 1998, and it was about 5 years later when the popularity went through the roof. It's very similar, right? You're putting bone cement into the fracture for instant stability, but it involves placement of a balloon first to make a bony void here into which cement is inserted. So here's the steps. You put the tools into the fracture. Okay, you can see this is a fracture through what's called the pedicle here. The catheter goes in. Then you insert saline to blow up this balloon. They call that a bone tamp. And basically what it does is it pushes the bone fragments up, down. It can help restore some of this height that's been lost here. Then you take the balloon out and you fill this void under slow insertion pressure with bone cement. And then you let it harden. It takes about 20 minutes. Okay? So what are the outcomes? First of all, you can see what makes it different than a vertebroplasty. Let's go back. You're actually putting this balloon in and you're inserting the cement under slow pressure. With the vertebroplasty, you're putting this in and then going ahead and putting the cement in under higher pressure. So you can't get as much in, you can't get the height back, but with both procedures, the outcomes are actually very good. You get immediate pain relief from the stabilization, and this occurs in over 90% of patients. The aching and the spasms may continue for a few weeks, but most of the pain goes away right away. So dramatic pain relief with significantly increased function, including walking and performing activities of daily living. Dozens of studies have shown this. There was a study in Lancet in both 2009 and 2010, though, that were very high-level studies. There have been some studies showing questionable benefit. They are far outnumbered by the ones showing incredible pain relief. Arizona Pain Specialists has award-winning, board-certified pain management doctors. There are 5 clinic locations throughout the valley. Over 50 insurances are accepted, and over 50 treatments are offered, including vertebroplasty and kyphoplasty for compression fractures. For one-number scheduling, call 602-507-6550. And to visit us on the web, just simply type in ArizonaPainNetwork.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.